somebody who's actually a worker in the natural gas extraction industry. And what are the issues that are different when you're dealing sort of in an occupational medicine situation rather than environmental exposure? And in the room we have some occupational medicine experts who've been seeing workers locally, so I want to make sure that you guys have a chance to talk about this a little bit as well. So here's how a case like this could present. A 35-year-old male comes to you, and you're seeing them in urgent care. Their cough is getting worse, and they've had a cough for a while, and it's getting worse, and they want to know what to do. And here's a guy who smokes a bit. He works as a truck driver. He's hauling sand for fracking, and he spends a good deal of his time not just hauling the sand, but being around the loading and the unloading operation that's going on. And he knows that his clothes get dusty. His supervisor gave him a dust mask to use, but then had to stop because there was a concern that was going to send a message that there was something dangerous going on, so nobody should wear a mask because it's going to scare people. He doesn't really have a history of breathing problems before, besides the smoking. No history of asthma in the past. He's been working for about 18 months, and he thinks that his problems got worse once he started the job. And he's been to a couple doctors, and they've given him some antibiotics and to sort of think that he had bronchitis, but the cough really didn't get better with the antibiotics. And he's noticed that when he's working extra shifts, he's starting to cough more and feeling a bit short of breath. So you do an exam, you see a little bit of, his eyes are a little bit irritated. You think you hear a little bit of a wheeze when you hear him breathe. So we've talked about exposure histories in the home, environmental histories. What should be asked about in an occupational history when you're seeing a worker who thinks that he's getting a little bit worse at work? And what should healthcare providers do to help? It's different from when you're just seeing a regular patient, when you're seeing a worker who has a possibly work-related condition. In medical school, we don't learn a lot about what it is to haul sand around, so we don't intrinsically know what all these people do in their different jobs, but oftentimes they are very good at talking to us about that and describing it. So, some basic screening questions for occupational disease, and there's a reference in the toolkit to an article in the American Family Physician that kind of lays out a lot of this in more detail about just the basics of occupational histories and management. But, basic things. What is your job? And tell me a bit about the job. And many of them are really good at describing it and describing whether they really feel they work with some chemicals and dusts or hazards in the work. And they often have a strong opinion about whether they think their health is related to work. But maybe no doctors have asked them that before. The doctors who gave them the antibiotics never asked that. And if you've left the job, when did you leave? Because maybe they're not working there anymore, but they've had exposure recently. This is a little small. You've got it in your handout. But some of the things that you said, do your symptoms get better when you're away from work and worse when you're at work? Have any other coworkers noticed problems? And then you can go into a little more detail about the job and ask about really what are the tasks that you're doing. And when you're doing that, are you wearing any personal protection or doing anything else to reduce exposures when you're doing that task? When exactly have you worked at the job? And have you gone to the company doctor or anybody else for this problem? And have you done any other jobs that have exposed you to things in the past to sort of get a more complete sense of all their exposures? And one of the things that I think people get a little buffaloed about occupational diseases, or that they think they're looking for something very exotic and tend to overlook the fact that most occupational problems show up as very common medical problems. So work-related asthma looks very much like regular old asthma. And many types of work-related dermatitis look like other types of dermatitis. So don't expect something to just jump out at you as looking like a zebra. It may look like a very common medical problem, and you have to think about, is there something that work is really doing to make this worse? So confirm the diagnosis. It's very hard to know what to look for sometimes, or how much to attribute something at work to the problem if you don't even know what's going on. Make sure that the rash that you're looking at, that you're wondering if it's occupational, isn't really a skin cancer or something like that. You want to make sure that you make the right diagnosis and get the person to somebody who can make the right diagnosis. Is it really asthma, or is it something else? assess the exposures, ask about the questions we talked about, and then really decide whether the exposure is causing the diagnosis that you've got. The ways to get more information to do this occupational history, you can ask to get some material safety data sheets from the workers and ask to talk to a supervisor. That's always a slightly political process, but it's something that you can really try to do. There is, for this guy, where we're talking about sand, there's actually been an alert published by OSHA and NIOSH about the fact that NIOSH, which is the National Institute for Occupational Safety and Health, has had industrial hygienists go into the fracking on the drill pads where there's a lot of unloading and loading of sand going on, and they've measured silica levels which are way in excess of the silica standard. So we know there's hazardous exposures to the workers for silica in many fracturing operations. So there's something in your toolkit about that alert, because that's a definite hazard that is something that should be controlled by the workers in the companies at this point. And it's difficult because there's many drill pads, many places, the workers are moving around. There may be good controls one place, not good controls another place. So a lot of usual workplace protections very easily break down in a situation like this. And then it's often important that the physician makes a call somewhere, a clinical call with the patient, and says, I really think this is caused by your work. It makes a big difference to the worker in terms of workers' compensation or getting them steered to the right thing and doing something about it. And you're making a decision, sort of more likely than not, do you think it's work-related? If you're not comfortable making those decisions, there are clinics, such as the one in West Virginia, where they're specialized in making that kind of determination. But it's really very important that it kind of gets made for the worker. And then in terms of what to do, we feel that it's really possible to fix environments in workplaces. There's ways to reduce exposures to workers if you can figure out what they are, and you can work with the company in some way to do that. There are referrals to occupational medicine specialists that can help with that whole process, and then whether to report the case. And when we try to reduce it, we really try not to just put masks on people. We think that that's the last resort. The best thing is to find a way to reduce the exposure at the source so that people do not have to get constantly exposed and then try to protect themselves with masks or gloves or something like that. And this guy should stop smoking, because that's anything else that makes it worse is something you can do something about. There's some resources here which are also in your resource packet. So remember that I think when you're seeing an occupational case, really that's a big opportunity to find out more about what are some of the hazards around natural gas extraction, because the workers are generally exposed to many hazards at a higher level than anything that gets out in the environment. Not always, but many times. And so there's a lot that you can do to help the person, but also learn a lot about the possible hazards that are out there, which we're all still learning about.